Joining us on the line is Doug Badger. He's visiting fellow in domestic policy studies at the Heritage Foundation. His career in public policy spans more than 3 decades and includes stints as a policy advisor to the White House, Senate, the HHS, and Social Security Administration. He's joining us to discuss President Trump's healthcare policy and conservatives' healthcare open letter. Doug, thanks so much for joining the show. I appreciate it.
Thank you for having me, Ben.
So President Trump has talked about overhauling Obamacare. He has suggested that he has actually overhauled it. In reality, we've put off the individual mandate, but we haven't done a full overhaul of Obamacare in any serious sense. So what exactly does President Trump's health care plan constitute?
Well, if I were to summarize it, I would say it is something that actually takes on the medical industrial complex, at least to the extent that an administration can. And as you know, President Trump isn't necessarily modest in his use of executive authority. Sometimes gets called back. But essentially, he's looking at within the four corners of Obamacare, what can you do to give consumers more choices, more information, more transparency, more options? And he's done several things along that line. First of all, radically, he's requiring hospitals to disclose their prices to people. Those are opaque, as you know. 6 or 8 weeks after you get your hospital visit, you find out that what you owe them. The idea is that hospitals now will have to tell you up front. You'll be able to compare the prices from one to the other. And if one charges 4 times as much for an MRI to the other, you might ask questions about why that is.
So let's take, sorry, can we take that policy for 1 second? So that policy, why have hospitals not been doing that up till now? I mean, I assume that there's administrative and regulatory reasons why hospitals have not been presenting their prices clearly. And I assume a lot of that has to do with the fact that they are negotiating very often the prices back end because they're still trying to figure out the formula for many people who don't have insurance, people who do have insurance, people who have government insurance. It's pretty complicated. How can we expect hospitals to actually present those prices up front?
Well, it's actually studies that have been done. The Rand Corporation, for example, just released a study last week of hospitals. And you'll find in one particular market, take away all of the different price concessions they may have negotiated with one insurer or another. The cost of a discharge varies by 4 to 1 for 2 hospitals in the same community. The reason they don't tell you is they can get away with it. The whole healthcare system is set up in a way to make it appear to be free or relatively cheap at the point of service, when we all know that a lot of money is changing hands, and the consumer is always the one who's kept in the dark.
So let's talk about the rest of President Trump's healthcare plan. Obviously, these are changes that he can make within the structure of the law. He's the president. He's not the legislature. So you were continuing with some of those. Yeah,
one of them is short-term, limited duration insurance plans. The Obama administration had taken away the right of consumers to renew them. So you can have them for 90 days, then you can't have them any longer. The Trump administration restored that right and said you can renew it for up to 3 years, which is a good thing when you think about COVID-19. A lot of people are out of work for more than 90 days and they need some kind of insurance coverage. The key to this is they're about 60% cheaper than Obamacare plans. So for families that find those premiums too high, they have an alternative now. He's also done things to allow employers to create tax-favored accounts that the employee can use to buy their own insurance in the individual market. This is potentially a largely transformative change in the sense that we would move from a circumstance in which your employer owns your health insurance to one in which you own your health insurance and are given a tax-favored subsidy. That could be a change that is evolutionary, but over time could transform the market. He's also done things with telemedicine on an emergency basis, but I think this has caught on to the extent that we hope that it can be made more permanent, and other innovations like direct primary care, health sharing ministries, and so forth can begin to get into the market on a larger scale. Finally, he's given small businesses the ability to band together and get the same kinds of advantages that large corporations have when they get insurance for their workers. So again, these are things around the edges. Congress failed in its attempt to repeal Obamacare and bring more choice and competition into the market. But the president has shown a real willingness, as I said, to take on the medical industrial complex and get some things done that are actually favorable.
Doug Badger, visiting fellow of domestic policy studies at the Heritage Foundation. Presumably, all this will come up in the debates with Joe Biden. What do you think is going to be President Trump's chief line of attack on Joe Biden, who has hesitated to embrace Medicare for all, but has also sort of placed many of these principles inside his own platform via Bernie Sanders?
Yeah, that's right. I mean, look, there really are two visions of healthcare reform. You have a group that believes that, okay, government's kind of screwed things up with Obamacare and with some of its other interventions. The answer to this is more government, and that's essentially the Biden platform. The Trump platform, and look, I don't have to tell you, I'm imposing some coherence here where it may not be entirely obvious, but what he's saying is the way to do this, to make healthcare more affordable, more widely available, is by increasing choice, competition, informed consumers, empowered consumers who, with their doctors, call the shots, rather than having those decisions made for them in Washington.
Doug Badger, visiting fellow of domestic policy studies at Heritage Foundation. Really appreciate your time and your insight, sir.
Thank you, Ben.